Good morning. I'm Tom Gehring. I'm the CEO of the Medical Society, and I want to give you kind of an update about what's going on at the federal level, the state level, kind of some things that I wanted our members to know about. Let's start at the federal level. The sequester has kicked in, and we have a continuing resolution, so at least the country has a budget, albeit last year's budget, all the way through the end of the fiscal year, which ends on September 30th. There are two big deadlines coming up. One is the budget deadline for 2014, and the other one is on May 19th. Our credit card expires as a nation. I expect the credit card issue, the debt ceiling raise issue, will be fairly entertaining, shall we say. I'm not sure how it will impact physicians, but I know that we as a nation are going to be glued to our TV sets around the 19th of May to see what happens in terms of raising our debt ceiling. Because the sequester has kicked in, Medicare rates effective 1 April will be cut by 2%. Not pleasant, and probably not going to change. I don't anticipate anything on the horizon that would mitigate that 2% cut. It affects everyone, from hospitals to doctors, anyone who provides Medicare services. For the Geographic Practice Cost Index, which is something that we've been working on for almost 8 years, there are two pieces of news. One is that we have prepared legislation. It's bipartisan legislation. We're looking for a vehicle to put it in. That's a bit of a recurring theme, but believe you me, it's been a tough challenge getting everyone in California lined up and then trying to get that past the Senate. The lawsuit that we filed, one of our physician leaders is a plaintiff, as well as the County of San Diego. We filed a lawsuit on the Geographic Practice Cost Geographic Practice Cost Index, otherwise known as the GIPSI. So that saga continues. I just want you to understand we have not forgotten about it, but it's an uphill battle. Let's talk a little bit about what happens with the Affordable Care Act. Effective the 1st of January, two big things happen. One, anyone who's below 138% of the federal poverty, roughly 15,000 as an individual, 32,000 for a family of four, those folks will be eligible for Medicaid, read Medi-Cal. Anyone who's between 133% and 400% of the federal poverty level, effective 1 October, they will be eligible for coverage using the health insurance exchange. That insurance coverage kicks in on the 1st of January, but the enrollment will start on the 1st of October, maybe. That's a very broad swath of people. Anybody who is between 15K and 45K as an individual, or between 32K and 92K for a family of four, will be eligible for the health insurance exchange coverage. The term of art is Covered California. There are many of us who are nervous about its implementation, whether it will be open for business on time, whether the regulations will be appropriate for physicians and hospitals. So there's much there that we're worried about. As a sidebar, there are 4 plan levels. They are bronze, silver, gold, and platinum. The only difference between them is a different premium and cost-sharing arrangement. Again, one of the concerns we have with the health insurance exchange read Covered California is that folks will be, I'll say this, won't raise their hand and says, yes, I'd like to do that, but they may be put into the health insurance exchange non-voluntarily. And then, of course, the regulations associated with the health insurance exchange are in the process of being written, and they're a challenge because some of them aren't physician-friendly. So we'll keep you posted on those. For all of you who are doing long-range planning, the health insurance exchange Covered California has the potential for being a seismic shift. There are various studies out, and you could say, well, there will be 6 million people, there will be 7 billion people, there will be 8 million people. That's a lot of folks. And so we're watching very carefully, and we'll keep you cut in. We have lots of material on our website that will help you understand that. Looking at the legislature, there's 5 things we worry about. One is opioids, prescription drug abuse. There is going to be legislation on it. We want to make sure that legislation is the right thing for our patients, not simply convenient for the legislature. MICRA is always of concern to us, the Medical Injury Compensation Reform Act of 1975 that keeps malpractice rates reasonable. The good news is so far that dog hasn't barked, to plagiarize Arthur Conan Doyle. We'll see. The good news is we have worked for literally decades to make sure that we have lots of people in the legislature who understand the real impact of changing MICRA. And so we're confident that despite having two-thirds majority, we'll be able to beat back any major assault on micro. So far there's no bill. There are lots of bills on scope of practice, and I'm going to talk about that in a minute. There's lots of legislation on implementing of the health insurance exchange. Another dog that did not bark is changes to the bar to the corporate practice in medicine. Our philosophy has always been we want doctors in charge of hiring doctors because we want doctors in charge of healthcare, not accountants. God love accountants, but we don't want accountants being in charge of delivering healthcare. We want doctors. And so far there is no bill to change the bar to the corporate practice of medicine. Let's talk about the scope battles. The physical therapists, the midwives, the nurse practitioners, the optometrists, the pharmacists, and physician assistants, in essence, all want to expand their scope of practice. We as the physician community understand we cannot live without allied health professionals. We can't. But we also don't want to willy-nilly simply say that you can do more unsupervised by a physician. And so our pushback is going to be, we value our partners in delivery of healthcare, but we want them to practice to their limit of training and under the supervision of a physician. So I would expect there'll be lots of battles in the legislature, and I will keep you cut in as always. There are two moves afoot dealing with Medi-Cal managed care, specifically healthy families, and Medi-Medi's dual eligibles. We can expect a lot of that to be happening. As always, we will keep you cut in, but if you have patients in healthy families or you're treating Medi-Medis, expect both of those to move to Medi-Cal within the next 6 months. Another thing that we're dealing with is the proposed cuts by the governor, both in the legislature and in the court, to Medi-Cal rates. We all know that Medi-Cal rates are abominable, they're the worst in the nation. But proposing a 10% reduction of that is not exactly going to drive physicians to take more Medi-Cal, and I'm being sarcastic. For those of you that read Dr. Franklin's op-ed, we'll also make sure that's on the web for you. It's pretty clear that we need to raise Medi-Cal rates, not lower them. So that's a battle that we're fighting. Cures is a database that allows physicians to check to see whether a patient has received narcotics through a prescription. On the 12th of April, we will be doing a session here at the Medical Society. All physicians are welcome, but you need to make an appointment, so we make sure we manage the flow of people. That will allow you to expeditiously get signed up for the Cures database. That allows you then to look to see whether Mrs. Smith has already gotten lots of pills from someone else. It's an important step in the fight against prescription drug abuse. I want to talk a little bit about the Medical Society Foundation's flagship project, Project Access. I want to read some stats to you. Please kind of look at the totality of what this organization has done. We've delivered $6.2 million in donated services through you, the physician volunteers, to Project Access. We have 625 plus physician volunteers. We've done 568 surgeries. This is just since December of 2008. 17 lives have literally been saved through the work that has been done by the physician volunteers of Project Access. It's a great program that allows you to give back without the hassle. That's kind of our motto, is philanthropy without the hassle. So if you're interested in becoming a contributor, either in money or in time, please let the foundation know. You can expect to see the ballots for the Board of Directors election in your virtual and your mechanical inbox in the next couple of weeks. And then finally, I'll close before I invite you to the White Coat Gala. There's been a lot of concerns about the way the votes are counted on top docs. It somehow disenfranchises solo, small, and medium-sized group physicians. We think the process is fair and open, but we also think that we can look more carefully at how votes are counted. So the executive committee has approved a change that will allow more representational participation in the selection for top docs by small, solo, and medium-sized group physicians. And you'll hear some of the details. What I would encourage you to do when you get your top docs ballot, don't simply throw it in the trash and say, they don't care about me as a solo, small, medium-sized group. We have specifically made some changes that will make those physicians much more competitive in the process. And finally, I hope that all of you, when you get your invite to the White Coat Gala on the 8th of June, that you'll come join us. My predecessor, David Netzer, whom all of us treasured, passed away in May of last year, and one of the things we're going to do is honor him and specifically present a very large plaque to his widow, Leanne Netzer. So I hope you'll make reservations for joining us on the 8th of June. As always, if you have any questions, please don't hesitate to call me. My cell phone is 619-206-8282. And as always, we are here to serve you as we are Physicians United for Healthy San Diego. Thanks.